By the way, again, this is Curbside Consult. I'm Harold Pollack talking to Joanne Kenen. But I do want to mention, by the way, one story which I think is getting way too little coverage, which is the real human tragedy going on right now among 5 million people who would be receiving Medicaid, except that they are in a state whose Republican governor has chosen not to embrace the expansion. And I think that, from my point of view, this is the most tragic single dimension, and it's one that has gotten too little attention compared.
We have covered it a ton. I mean, I've seen others covering it. I mean, the Times has had some. I mean, I don't know that every paper around the country had it. I think there's been a fair amount of coverage, and we've actually had 2 of our 6 reporters spend most of their time covering the states, and we have written many stories about both the politics and we've actually we had a reporter go to some clinics, and we're very Washington focused, and we actually did have somebody go on a plane and talk to poor people. So the administration's really been hitting that this week. The president went to Texas the other day. He's going to Florida and Louisiana. Florida, Rick Scott is a very, very conservative governor who's very anti the ACA. He has, in fact, tried and really tried, not just put out one press release. I mean, he did try to get it through his legislature, and he probably will continue. Louisiana, Bobby Jindal's not about to change his mind. Texas, Rick Perry's not about to change his mind. We do see a number of other states who still could go. We've not the Pennsylvania situation's in flux. Tennessee is in flux. Virginia is in flux. Obviously, McAuliffe wants to do it. He can't wave a magic wand. There's a legislative commission. It's complicated, but it's a.
John Kasich almost waved a magic wand.
John Kasich was, and Jan Brewer. I mean, they were both. Jan Brewer, he's a very conservative Arizonan. She basically came out, and she had a huge fight with fellow Republicans, and now some of them were talking about suing her. She got it through, and she got it through on basically a morality and fairness grounds. And John Kasich has been saying, and he was the House Budget Chairman before Paul Ryan. He's another conservative guy, and he's been making really an interesting. He really talks about it as a moral case about taking care of the poor, which isn't. It's not what Rick Perry's talking about. It's been very, very interesting to watch Brewer and Kasich.
I agree. That is the part that makes me the most optimistic, although I fear that the performance failures in the early stages of the website and so on have made it harder to make the case around the country. If right now this were rolling out really well, then there would be more pressure across the country to say, hey, whatever our former disputes were, we got to make sure that poor people can get health care, even though Medicaid is actually going much better than HealthCare.gov. The overall story is not one that is increasing the pressure for this critical issue, and it's you got to do a good job when you implement government. If your claim is government can help people, you got to prove it. And
if you're a Republican who hated the Affordable Care Act, there are legitimate governmental congressional oversight questions that both sides are asking, and they're asking it with a different clause after. The Republican is, I want to know why hundreds of millions of dollars in this website doesn't work, and I hate the law. And the Democrats are saying somewhat more softly, we need to know too about why we spend hundreds of millions of dollars and this website isn't working, and I love the law. But this is not a made up political slogan. This is a very expensive 3.5 year, hundreds of millions of dollars. Every time you look, you get a different number. We both FOIA'd the contracts, and we don't really know exactly who was paid what or what the performance bonuses are and who doesn't get paid until they fix it. I don't know any of that yet, and maybe we won't ever be able to add it up correctly. But yeah, if you think that if your government spends a couple $100 million and spends a few years and has an army of contractors, that they should be able to get a website that works. The president has an awful lot riding on this whole program, and then to have it not be able to go forward because a website doesn't work.
Well, I bet you many liberals around the country find Al Gore's Reinventing Government initiative a little bit less boring than they thought 2 months ago. This is I mean, anybody who's covered the Pentagon could tell you certainly hundreds of millions would be a drop in the bucket if you looked at the F-35 program or the F-22 program or pretty much any set of letters and numbers that you put together in government procurement. We have to find ways to improve the performance of government in some of these key tasks, and it's a very humbling insight because those of us who uh, there's a number of ways you can take it. Mike Kinzel wrote a great piece where he said, "Is this failure a critique of liberalism?" And he basically says, "Look, if you had a more lefty, more comprehensive social insurance program, it would actually be much simpler to explain and much simpler to implement." And actually, I think some of the conservative and some of the left critiques are actually both are quite consistent with each other, and we have a political process that produces a very kludgy way to do stuff that does not execute at the level that it needs to execute at, and we're seeing and we see this being played out. I must say, the website will work. I'm convinced personally that it will work. You know,
I don't know that you can be 100% sure it's going to work in time to get people signed up by January 1st. I mean, I just don't think we know that. I mean, is it working better than it was working before? Yes. Is it working well enough to handle the volume they're talking about? Right now they said it can get 17,000 applications an hour. Well, that's not the volume that we saw in the first few days. And that's just that initial step. That doesn't mean it's getting, I mean, they haven't told us metrics on other stages of the process. So, it's November 8th. There are only 4 weeks in a month. I don't know that I have talked to people. I mean, and it's all guesswork on the outside, right? I've talked to people who said, yeah, they're going to be able to get it up the whole problem. It's a 2-month problem. I've talked to people who said this is a 6-month problem. So, I am not in the room where these coding geniuses are trying to fix it, and I wouldn't understand it if I was. So I don't know that we know and I don't know that they know, right? I mean, I don't know that anybody it's such a complicated system that anybody at this point, that they've been working on this login enrollment stage. They said yesterday some new problems would come up. As they get deeper into this complicated system, I don't know what other kind of, cyber brick walls they hit. So, I don't think that anybody that I don't think even the geniuses necessarily are completely sure that there's not other bugs in there waiting to bite them when they get to that part of the system. I mean, we know that they've said their punch list is hundreds of items, and I have, no idea of what that means as a non-technical person in that room.
there well, on that, I will say that one of the heartening aspects to a somewhat sobering way to close out this conversation is what's now happening is all about performance. Do things work? Are people helped? What is the real experience of people? And the debate about health reform has gone from this 50,000-foot ideological thing to the real stuff. And I think I don't think it's going to be a 100% success or failure. I tend to think it will be closer to success than to failure ultimately. But it's the real work that there will be some bugs. People will emerge with some bug bites on them. But the health system before ACA was one in which 50 million people were uninsured, and in which, in many profound ways, the system was failing. So, as an incremental improvement, hopefully 3 months from now we can sit down over drinks and say, wow, that was really a tough patch, and we can see that we can begin to see the improvements in people's lives. And that's the appropriate test, I think, for this, because it's it's not about partisanship and ideology, although those things are inevitable and important. It's really about, can we execute something so that we have a better health system? And I think this is actually a better place to have that fight than it's been over the past several years because it's real. And so I want to thank you for joining me, and I'll let you go about your day, but I've really enjoyed this conversation. I hope we can have it again.
I would love to. It's been great, and there will be plenty to talk about, and all I can think of is, wow, it would be really nice to have time 3 months from now to sit down and have a drink, right?
Yeah, as a reporter, you must be, you guys must all be burning fumes at this point, given...
Yeah, right. I mean, you don't even want to know what I ate for dinner tonight, but we can leave it on that note.
Okay, we will leave it on that note, on the lean cuisine note for 2013.